So we have really a stellar panel today. Mostly whenever we talk about environmental health, we have people from various disciplines. But I think for the first time, we are having a panel full of doctors. So if I request first Dr. Aru Varda, consultant pulmonologist, Kolkata Medical Research Institute, to come explain this. Next, I invite Dr. Ausaf Chaudhary, consultant pediatrician, Apollo Mercy Specialty Hospital. Hope it's checked. Then next we have Dr. Sanjukta Doctor, head of emergency medicine, Fortis Hospital. Yeah, please. We have Dr. Kaushik Chaki, clinical cardiologist, executive member, West Bengal Doctors Forum. And our last panelist is Dr. Suman Malik, clinical director and chief of radiation oncology, NH Narayana Super Specialty Hospital. Welcome. And before we actually start our project, we also tries to develop a health-based early warning system for this city, because the government of India through different ministries have heat wave forecasting, air quality forecasting and all of this. And we want to establish epidemiological relationships specifically with the local health data from these two cities, so that those warning systems can be translated into a more health-based warning systems. Okay, welcome Dr.
For last 2 or 3 years, in our textbook of medicine, that is known as Harrison's textbook of medicine, that is Gita for us, we have a new chapter that is climate sensitive diseases. So as a practitioner, we are continuously watching that the risk factor for diseases are actually changing. Previously, COPD or chronic obstructive pulmonary disease used to happen in smokers. But now many non-smokers, even people of elder ages, are being affected with this kind of disease. So all the risk factors, the presentation are changing regularly. But we are seldom talking about these changes because it takes a lot of time to actually notice these changes in our day-to-day practice.
And I have seen the shift. When we were kids, how many of our friends used to go to hospital to take oxygen or nebulization? Now it has become a norm. The parents are not taking treatment. There's a doctor is told to take some nebulization and then they will go back home. But this is not the normal way of life. This is not usual. It should not be like this. And there are many. We see so many young heart attacks, so many young strokes. That is beyond imagination, and that is changing. See, as my doctor was saying that it is changing over time. Maybe that's why we are not noticing it. But as we are in this field for a long time, we can see this shift. And it will be great.
We all know that there are some EE factors of air pollution which is now gradually picked up everywhere, and a little bit also that fetuses are getting affected in Europe. And it is not only that to the later part after birth, but also in utero. So that means their affection actually everywhere is going toward like lower to it. Then there is a premature delivery for this apparition, and the exchange apparition is always detrimental for the fetus grow also.
In our profession, we are navigating the dual fate of feet and air pollution in daily life, and professionally, we are the last line of defense. Okay. The patient clients that comes to us having suffered several illnesses, and I being a clinical cardiologist, I see cardiac patients in emergencies, in critical care units, in cath labs, and in non-legacy cardiac departments. Yes, there is a significant increase in hypertension, geriatric issue. There is a significant increase in arrhythmia. Related issues by arrhythmia, I mean abnormal heartbeat, which that even cause instant death in a patient.
So being an oncologist, I have in my routine practice, we are seeing more number of
cancer patients who are not having any history of smoking, tobacco chewing, but they're coming with lung cancer, head and neck cancer. And when we tell them, please don't, even the smokers, when we tell them, please don't smoke, I always think in my back of mind that actually who are non-smoker over here, they're smoking 8 cigarettes per day, especially who are living in city or city-like Calcutta. So for the same reason, we are seeing more and more number of lung cancer patients in non-smokers.
I had a question. You mentioned a lot of outcomes that you see are increasing, or this may related to heat stress and air pollution. So I was wondering about kidney diseases because kidney failures is often associated with dehydration and heat. Is that something you have seen? And also,
Both heat and pollution can increase blood pressure. So we are seeing high blood pressure in ER people, and I am a part of my kidney transplant team in my hospital. So when I sit there, I see that these people who are coming for kidney transplant, there are people around 20s, even the teenagers like 19, 18, 19, early 20s. So basically most of them are started from hypertension and then landed up as kidney disease, which both of them could be affected by heat and air pollution.